Hi, my name is Paula Brown and I'm an F&P student and I'm going to do a video today on the chest, heart, and lungs. What I'm going to do first is I'm going to inspect Mr. Griffey's chest. And when I do that, I'm just going to look from side to side, right to left, make sure that everything is symmetrical. I'm going to look from front to back in color and make sure that the color pattern is the same. I see that there's a little bit of superficial venous areas going on here. I'm also looking to look at his respiration rate, the rise and fall of his chest, if he's using accessory muscles. So what we're going to do now is, I'd like for you to tilt your head just slightly up. I'm looking at the trachea. I'm making sure that the trachea is midline, that there's no deviations. I come down here to the supraventricular notch, which is right at the base of the throat. These are all landmarks that we want to follow when we assess. Going down to about right there is where our angle of Louis is right above the sternum. And then we're going to go down to the costal angle, which is at the apex of the ribs right there. And when we come back around here, we see that C6 and T1 is at the base of the neck. So right now, as I'm visually looking at Mr. Griffey, everything appears to be fine. Now he's got his hands down by his sides. Give yourself a big bear hug, Mr. Griffey. I'm looking from behind at the thoracic area, and everything is symmetrical with no issues here. Go ahead and unfold your arms. So what I'm going to do now is I'm going to palpate the chest. Any pain or discomfort when I do that, Mr. Griffey?
No.
Okay, so what I'm looking for there is crepitus. I'm looking to make sure that there's no clicking or popping, which would indicate air in the presence of those areas. So moving forward, I'm going to do the Fremitus test. So Mr. Griffey, I'm going to take the palms of my hands, I'm going to place them on your back. Every time I do that, I'd like for you to say 99.
99, 99, 99, 99,
Okay, very good. Let's go ahead and do the front.
99, 99, 99, 99.
Okay, so that just allows vibration to hit my hand, that the air is flowing throughout his cavity there. So as we move forward, we're going to go ahead and we're going to do some percussion. And what we want to do is we want to go from right to left, okay, so that we can compare. So I'm going to start up here, and we always want to go in between the ribs and the intercostal spaces. We're going to start at the second. Okay, we're going to go ahead and you want to turn around, Mr. Griffey. We'll go ahead and do the back here. Okay, perfect. We're going to find it. You get to a dull sound, you're going to know that you're over probably the liver. So what we're going to do now is we're going to check for thoracic expansion. I'm going to cut my hands around his back here, up near his spines. I'm going to place my thumbs. And I want you to take a deep breath in, Mr. Griffey. Let out. Another one. Let out. Okay, so that's almost like a billow effect. Normal range there should be anywhere between 2 to 5 centimeters for an adult, and his was within that. Okay, so now what we're going to do is I'm going to auscultate. I'm going to listen to your lungs. I want you to take some deep breaths in and out. Okay, we're gonna go up here, take some deep breaths for me. Okay, very good. I'm going to go ahead and do a chest measurement on Mr. Griffey. Just going to go underneath the arms, right around the nipple line. He's at about 49. Go ahead and take a deep breath for me. Let it out. Okay, and so that was about 1 inch difference upon expiration and inspiration and expiration. So everything was fine with that. So now, if you turn around, Mr. Griffey, you're getting good at this. Take your time. Okay, so what I'm going to do now is I'm going to palpate the heart. And we know the heart lies right about there. Okay, so I'm going to palpate the heart. Okay, now what I'd like for you to do is I'd like for you to lean over. Just stay right there. And then listen down here. Okay. All right, very good. What I'd like for you to do now, Mr. Griffey, is I'd like for you to come over here and, well, before we go there, there's one more thing that we needed to do. We need to find the difference in size here. Take a deep breath for me. Okay, let it out. Breathe in one more time. Okay. All right, let's do it on this side. Take a deep breath for me. Okay. So as we measure that, it's just about the same size on each side, and it's right at about 2 inches. So good for you. All right, let's go ahead and put down here on
my back.
your back, yes. Take your time. Yeah, I'll help. There you go. Okay, so I'm just going to go to the second intercostal space here. Okay, I want to feel for the apex of the heart. We're right around the 5th intercostal space. I'm going to, okay, right there. If we follow that around, that's going to be the lateral border of our heart. And usually if there's any enlargement of the heart, it's going to be the left ventricle, which is down here. Okay. Here's the aortic, here's the pulmonic, here's the tricuspid, and there's the mitral. I'm going to go ahead and listen. Okay, can you roll to your left here for me, please? Not all the way. I just want to get right here. I'm listening to the apex of the heart. Okay, very good. Okay, so that's the conclusion of my video, and thank you so much.